Well, now if I'm a benefits director or an HR leader out there and I probably suspect that there's some unclaimed value in my plans.
Oh,
And
yes.
but I wouldn't, other than doing an annual review with my consultant or my team or my partners, you wouldn't really know where to start. What do you think they should be asking first?
I mean, look, Ross, just a couple examples. I'm just going to share with you from literally recent employee conversations. One of them is as it relates to claims audits, and then the other one is as it relates to VB. Okay. Question is simple. Let me start with the VB. Question is simple. How many voluntary benefit claims that are not related to wellness, the $50 because you've gotten your screening done? How many accident, hospital, and major diagnosis or critical illness claims have been paid out? They don't know. They know a loss ratio, which includes so many different things like reserves, etc. They have to wait for an annual review with their voluntary benefit carrier. Oh, we don't know it. Oh, it's moved up. Now it's, this month versus this month. And then you just don't get a view of, you know, doesn't need to be a daily view, even though we do give a daily view and 24/7 view of how much is owed, how much has been paid. I can't believe that they don't know that. And it's I'll touch on the fiduciary landscape in a moment, but that is a struggle. That's number one.
As somebody who's run budgets, like not having that data, you're you do not want to be caught off guard when the CEO calls you in and says, "Oh, how about our voluntary
But
benefits?"
also, like, you are hoping you you wanna take into account what these dollars are in your medical design because you're banking on some dollars going back to the employees' pockets when you are, as an employer, in the uncomfortable decision to increase the deductible yet another year by $200 at the individual level. And so it is dollars that employers feel like we don't know how much it is. We don't know how to quantify them. That's it, like the opportunity is unclear how to quantify. And then more importantly is actually what is actually realized so that I can feel like my employees are actually benefiting from these products that are supposed to supplement health. They're called supplemental health products for a reason. They're supposed to supplement your health needs. So there's this angle. The other angle is, employers do, with their consultants, do sample claims audits, and they are very useful. I've learned that the consultants, the experts on the consultant side that do this, wind up sitting inside of the claims adjudication system of the carrier, with the carrier's approval, of course, and they're able to work together on any pattern recognition, et cetera, give an idea to the employer about how this is running. And these are certified audits, and they're very useful. Um, the problem is, okay, what about other than the sample claims that we have seen? The other question that is almost always on everybody's mind is, and is it affecting my employees? I know it's affecting me. Is it affecting my employees? And that now gets me back to that fiduciary landscape, which a lot of benefit leaders, their CFOs and companies are having to really consider. Um, the employer group health plan, according to ERISA, has to make sure and ensure that the plan is working to the benefit of the plan participants, not just to them as the business, but the plan participants. And so it's interesting if you produce a report to an employer and you put it in front of them and you put the onus on them to act when they don't hold the relationships with all of the providers, et cetera, you're putting them in a worse off position than not having the report in their hands. So
Yep.
the ability to move from insights to action is so important. Otherwise, you're putting them in a more vulnerable position.